Hello, my name is Casey Swindler, and I'm with Pensacola Mom Collective, and I'm here with Lucy Shelley, and she is one of our lactation consultants over at Ascension Sacred Heart, and she's part of the childbirth educator program. So I'm really excited to talk with her, just all things about lactation consultants and what they do. So Lucy, could you tell me a bit about yourself and your role as a lactation consultant?
So I've been a lactation consultant for over 10 years. I've been here at Sacred Heart for about a year. I love it here. And what a lactation consultant does for our families is they're there to assist a mom reach her infant feeding goals. So by being a credentialed lactation consultant and internationally board certified one, we're considered the experts in lactation. And so what we do for our hospital and for our families is provide evidence-based recommendations so that moms can be successful with breastfeeding and have the right protocols in place and education.
Wonderful. That's much needed.
Yes.
So what would you say, there's lots of things on the shelves and whatnot, and for moms, what would you say are the top breastfeeding must-haves?
Support, education, and patience. You're right. There's a lot of products out there to buy for breastfeeding, but I tell my moms to focus on the first couple of days. Those first couple of days, we don't necessarily need a lot of accessories. We just have to have everybody on the same page in your core unit, your partner, whoever's visiting you in the hospital, what your plans are to do for infant feeding, so they can know the importance of you getting off to a great start. And that's why I highly recommend taking a prenatal breastfeeding class. We have one that's offered through the hospital. It's virtual right now. It's very easy to find through our website to sign up for. We have one a month. So if not coming to a class, reaching out to our lactation team here, even while you're pregnant, and saying, hey, what are some resources and things that I can review just to get ready, so that you can know what to expect, because although breastfeeding is natural, we have to learn how to do it. And so going into it, having that base knowledge can really make a huge difference. And then being patient with yourself, because again, it's natural, but you're learning how to be a mom and learning how to feed this baby. And then your baby is learning how to eat for the first time. So all around patience.
Got it. Great advice. So as for first-time moms who have heard that breastfeeding may be painful, how would you address that concern?
Uh, so I'm real with people. Is breastfeeding supposed to hurt? No. But is it different? Yes. I mean, we all feel things differently. We all have different sensations in our body. So it might be something that might be uncomfortable for you. It might take a while to get used to, but actual pain and having any type of damage or tissue damage on your nipples is absolutely not normal. And so going back to the learning about breastfeeding, coming to breastfeeding class, we can teach you how to hold your baby and how to latch your baby to prevent it from hurting. If at any point during your breastfeeding journey pain arises, it's just an immediate, hey, I need to see a lactation consultant. I need to call my nurse to the room, find out what's causing this so that I can hold the baby and latch the baby in a way that's not hurting me.
Oh, wonderful. Let's see. And what would you say are some ways that the partner could bond with the baby? With breastfeeding, obviously it's relying on the mom, and how does dad or the partner become involved?
That is such a good thing to talk about. So when you study infant bonding, babies don't bond through eating, which is strange because if you feed me, I bond to you.
Yes.
But babies don't operate that way. The part of their brain that lights up during bonding, when we look at this underneath MRIs, happens when they're held in skin to skin. So moms and babies bond during breastfeeding, but it's because they're also in skin to skin during that feeding.
Wow.
So dads don't necessarily bond through feeding because mom's doing that in the beginning. So it's a very obvious concern a lot of our partners, dads have. So doing skin to skin is what's going to do that. So that's stripping the baby down to the diaper and placing baby directly on partner skin, putting a blanket over both. Talking to your healthcare professionals about how to safely place babies is always important. And we do that kind of education all the time here. Then the baby is going to be learning that person's scent. They already know mom's scent. They already know mom's heartbeat, and they're learning those things with the partner dad as well. But the other thing is they're learning the sound of their heartbeat. So skin to skin is crucially important for bonding in those early days.
Gosh, that's amazing. I did not know that. Great information. And just, I mean, Absolutely amazing. So then when would you say that moms should begin to pump? Once their supply has maybe started to come in, how do we navigate that?
Another great question. So the first couple of weeks, we really want to establish breastfeeding. And the reason is when you pump, it sends a signal to your brain to make milk, but not as strong as baby latching. So we really want to focus on just learning breastfeeding and getting into the flow with that. If for some medical reason we have to feed your baby alternatively, we'll definitely have you pump for those missed feeds. But in the beginning, the best thing to do is to just breastfeed. And as cheesy it sounds, just go with the flow with latching. But I get asked that probably about 10 times a day because it's an important question.
Yes. And then, so once I guess pumping is established after a few weeks and they're more used to that and it's appropriate time, and then introducing a bottle. When would you introduce a bottle then?
So a good developmental window for babies where they're not going to be confused and maybe have a hard time latching after they receive the bottle is 4 to 6 weeks. There's exceptions to this rule. Sometimes we have to introduce bottles early and it's fine. We can get those babies breastfeeding. It's okay. But if things are going well and we don't have to do bottle feeding, that is a good time because most of our moms want the flexibility to give breast milk in a bottle sometimes, or they're going back to work or whatever the case is. So that's usually the general timeline that we recommend.
Okay, great. And then, so moms, they're breastfeeding and they come across, they want to talk with a lactation consultant. They want some ongoing support after the baby arrives. How can they get that?
Well, we do have an outpatient center here that offers free lactation consults and free telephone talks as well. So you would just contact us through Monogram Maternity. Our number is 850-416 NEST. So it's easy to remember, NEST. So that's a free service that we offer to the community. And we do take referrals from your healthcare providers if you do need a clinical lactation consult, or if you would just like to come in and get things checked out. So we are a resource. There is a local breastfeeding support group called the lactation League. It can be found through their Facebook page, which is Pensacola lactation League. So the two really good resources for breastfeeding moms if they need support or have questions or concerns after delivery.
Okay, wonderful. And then really just, is there any last minute comments or any words of advice or encouragement you have for expecting moms or new moms as they take on their breastfeeding journey?
I think I covered my keynotes, but is there anything? I mean, we recently shared that you have a little one, so something that related to breastfeeding that you would have wanted to have a lactation consultant answer for you, or?
I think with having 3 young children and I've been able to nurse them all, I think one of the biggest things was to, like you were saying, being patient with yourself. And then I think so often we think, oh, I need to feed them at this time, and if they're not done nursing, we get stuck in these boxes as to what we think is right or something, instead of maybe just listening to your baby. And sometimes that can be really just do a lot for the mom's brain and really exhaust us more than we need to. So that is something really just like observing your baby and being able to use your mom instincts with it.
I'm going to hone in on something that you said, watching your baby, not the clock. We're in a very measured society. And trust me, I'm a nurse. Like, we're supposed to measure things to a T, but with breastfeeding, it's trust and intuition and knowing that our body made this amazing baby and we can feed it too. And not only can we feed it, but we can feed it with something that, I mean, breast milk has over 400 ingredients. Some of them aren't even mapped. We're not really even sure what they are, but they're amazing and they make our babies thrive and grow. And it's something to be really proud of. So I appreciate you sharing that because, I mean, let's be real, I could talk about breastfeeding for days on end. So it's important to know what to focus on, and watching your baby is very important. So you'll hear recommendations, you know, how often do I feed my baby? Every 2 to 3 hours. That's a baseline, but sometimes babies want to feed so much more. So we just listen to them.
Right, especially in those growth spurts or anything, those cluster feedings that happen. And yes, it's amazing. But great, that is so informative. And for parents out there, I hope this has been really informative for you. And Lucy, thank you so much for your time. And we'll definitely be reaching out if anybody needs any support.
Thank you.
Thank you.